Hello, I hope you're all well. How are you doing? I'm never quite sure how to start these broadcasts, so I always end up saying like hello, sounding slightly creepy. Anyway, hi guys, how are we all doing? I hope you're all well. I hope you're having good weeks. Today, I want to continue my series on different therapies and remedies that I use in my Halcyon Days program that many of you will have come across, and just kind of give a little bit of background to saying what they are, how they work, how they specifically help with endometriosis. And today it's the term of acupuncture. Now, acupuncture is fabulous therapy, it's fabulous treatment. A lot of people try acupuncture as maybe their first foray into the world of alternative medicine, and that's because I think acupuncture has been the most successful crossover treatment. You see it in a lot of GP surgeries and a lot of specialist places. For pain management, you see a lot of acupuncture being used alongside NHS treatments, which is fabulous. However, it's kind of a little bit of a minefield. So I want to talk firstly about what it is, the different types of acupuncture. I am by no means an acupuncture expert. We have an acupuncture expert within my Halcyon Days crew, Sally Varley. Check her out. She is awesome. She does a lot around fertility treatments for women who are struggling to conceive and balancing hormonal cycles and things. So she's fabulous. She works alongside me on the Halcyon Days stuff as well. So if your cycle is an issue, or if conceiving is an issue and you need Sally's help, then that's all part and parcel of your Halcyon Days program with me, because I do other stuff as well that helps alongside the acupuncture. Anyway, that's a by the by. So acupuncture, I am, like I say, I am by no means a specialist in acupuncture. I have studied the techniques. I am qualified in Moxibustious and Acupressure, which I will talk about towards the end of this session, but I'm not a qualified acupuncturist. I am scared of needles, so it's not the therapy for me, which is why we need Sally in terms of helping my clients. So acupuncture is, we've already talked about it in the last couple of broadcasts over the last couple of weeks. We've talked about the essence of qi, the fundamental philosophy of qi and belief of qi in pretty much all Eastern natural alternative complementary medicines. This concept of an energy flowing through it that needs to keep flowing freely, unblocked, in order for us to keep well, in order for us to stay disease-free, illness-free, and symptom-free. As we know from previous broadcasts, blockages in this qi are responsible for pain, inflammation, clotting, buildup of toxins, all that kind of nasty, icky stuff, especially that we see in conditions like endometriosis. So that's just a very quick recap and a very, very brief summary of what qi is. Now, in terms of traditional Chinese medicine, TCM, you'll see me refer to it quite a lot. This energy flows through us in terms of meridians. So if you've joined my broadcasts before, especially my webinars, you'll have heard me talk about meridians and liking them to, I always use the Nile and all the subsidiaries of the Nile, and that's pretty much what they are. They are channels, they are rivers of this energy that flows through us. In traditional Chinese medicine, this is essential to the concept of being well, and again in other therapies as well, in other traditions as well, but meridians is central, especially to Chinese medicine. You'll hear other terms, sort of chakras and things that we'll talk about later on in terms of energy centers, but in terms of Chinese medicine we always look at meridians primarily, and the primary meridians. There are hundreds of meridians that are running through our body, but like the Nile, there are key ones that run down and up our bodies. Yin and yang, masculine and feminine, they're all balanced. They all should be balanced. They all should be unobtrusively flowing. I don't know if that makes sense, but you know what I mean. So acupuncture. Acupuncture is designed to remove the blockages in these energy channels. Some of the acupuncture you may have come across isn't necessarily kind of in that vein. So we have westernized some forms of acupuncture to suit our own needs. So for example, you may well have seen, if you've been to a physio for a poor shoulder or a bad knee, that the physio puts acupuncture needles in the area where, in the localized area where there's pain. That's probably the most common form of acupuncture that you find within our mainstream NHS services. And the reason for that is because it's kind of more accepted in Western terms that the pain is where the problem is. So quite often you'll go to the physio or the doctors with a frozen shoulder or a tennis elbow or something like that, and you will receive acupuncture in the area where the pain and the inflammation is, and that's fine. That's doing its job. It's stimulating the body's natural healing tendencies. So if you injure yourself, the body sends energy, it sends everything that the body needs to heal to that area, and it concentrates on healing it. So kind of what you're doing in terms of the localized acupuncture is stimulating those healing processes. So if your knee is bad, you're stimulating the knee to produce extra or to boost that natural healing of the knee in that area. So that's kind of the essence of how this localized acupuncture works, which is, like I say, possibly the acupuncture. If you've been to mainstream NHS acupuncture, that's possibly the acupuncture that you've been exposed to. In terms of traditional acupuncture and the acupuncture that I talk about and that Sally works with, this is more Eastern medicine based. So this is where we start talking about the meridians. So in acupuncture, you have various different points along the meridians, so along the energy channels, that are specifically targeted to help with specific ailments. Now, that's not to say that you have an endometriosis spot in between your big toe and your second toe. It's not that specific. So we link everything to the meridians. The meridians are linked to organs. So as an example of this, things like worry, things like anxiety, things like fear are all intrinsically linked to organs. And if you've worked with me before, you'll have heard me talking about this to you in terms of your specific ailments, your specific emotions. They're linked to organs. So for example, we have the spleen meridian, we have the stomach, small intestine meridian, we have kidney meridian. They're all linked to organs. They're all linked to energies, to emotions, and they're all linked to their own symptoms as well. So kind of, again, there's different levels. So on a basic level, if your energy is imbalanced, so if you have blockages in energy or you have a surplus, or so if your yin energy, if your feminine energy is depleted, you will have a certain set of symptoms. If your feminine energy, your yin energy is heightened, then you will have certain symptoms. So it all depends on the symptoms you experience as to what acupuncture points you use. So if you're going to somebody for acupuncture, traditional Chinese medicine acupuncture, they will take a lot of time to identify what's going on with your body. So we look at skin, we look at tongue, we look at eyes, we look at hair, nails, all of those kind of things that really show a practitioner what's going on in the body. We look at emotions, we look at unbalanced emotions. So for example, if somebody's really calm all the time, people think that that's really good and that's really zen, but actually there's an imbalance there because you need that fire as well. So we look at all aspects just to see which elements are out of balance. Then we can start looking in terms of what meridians to address with acupuncture. So the basis of this is that you have your spots, if you like, on your meridians, and each of these spots correspond to a certain place. So you'll see SP9, so spleen 9, spleen 6, things like that refer to, it's almost like junctions on a motorway. So if you think about, mixing metaphors, but if you think about the meridians in terms of the road network, then you have your motorways and you have your junctions on the motorways. And that's almost what we're talking about here. We're talking about areas or even service stations where you stop for refueling both your car and your mind and your body. That's kind of what we're talking about in terms of acupuncture points. Sorry, I've got a dog stuck behind the thing again. That happened yesterday when I was doing a live as well. She's not really stuck, I don't think. I think she just likes curling up in the most inappropriate of areas. So she's distracted me. So yeah, we're thinking about refueling stations. We're thinking about service stations on motorways and on roadsides. And that's kind of what acupuncture points are. They are points along these meridians that if you pop a needle in them, it stimulates them. It stimulates the energy. It removes blockages and it gets things flowing again. So exactly the same with the Nile, as if like a tree's fallen over and you remove the tree. That's what we're doing. We're unblocking those energy channels. So we're getting that energy flowing to keep us all well and well-being heightened. That makes no sense. To keep us all well and to prevent stroke, getting us feeling better from disease. So that's kind of essentially how acupuncture works. So you will find, this is why sort of people find it a bit bemusing, because if they've been to a physio that's offered the localized acupuncture, so they've been for a sore knee and they've had acupuncture in the knee, and then they go to a traditional Chinese medicine practitioner for acupuncture, they sometimes feel a bit bemused because you can have an acupuncture needle coming out of your head, one coming out of your toe, a couple in your knee, maybe one in your lower back, and it's not necessarily obvious as to why they're there, because it's not necessarily localized. It's not where the pain or where you're experiencing your symptoms. And this is why. So this is why they are seemingly randomly placed. They're not random at all. They're in very specific points that relate to specific symptoms that you're feeling. When I say symptoms, symptoms in traditional Chinese medicine and acupuncture are signposts. So we can have a look at your symptoms, not always the obvious ones. And again, if you've worked with me, I know some people quite often think, why on earth is she asking me these questions? We look at everything. And then we can determine what's going on. So we can target that spleen meridian if you're spleen deficient. We can target, there's different points as well that you can target for general sort of boosting of energy as well. And they're really, really useful points to know. So that's why acupuncture points don't always form an obvious link to the situation that you've actually gone to seek help with. So that's the basis of acupuncture. That's how acupuncture works. In terms of doing acupuncture on yourself, because this series is kind of designed to make it a little bit more accessible as well. So you can do acupuncture on yourself, although I would never recommend it to anybody at all. If you want to try acupuncture on yourself and learn about the acupuncture points, I would always recommend trying something like Acupressure, Moxibustious, although that does take a little bit of training as well, and almost like EFT, emotional freedom technique. So all of these strategies, all of these techniques use acupuncture points without puncturing the skin. So acupressure is the most obvious one of those. So we take acupuncture points and we apply firm pressure. So what you're doing is kind of, I was going to say hurting, but I don't mean hurting. You're stimulating that healing in the acupuncture point, but you're not actually piercing the skin. So in this, so if you're going to use acupuncture and this acupressure, and this is what I use with my clients. So I would, after the assessment, we would work out exactly what's going on with you in terms of your endometriosis. We would identify any acupuncture points, and I would give you those as homework, for want of a better word, and then we would do the acupressure points. So I am qualified in acupressure, just not acupuncture. So yes, so that it's kind of similar to reflexology. So again, that's an alternative that I would give my clients as well, sort of reflexology points. Now, all we do, if you want to do acupressure, is, well, there's various techniques. The way I sort of do it is just really pressing really, really firmly and holding in. And the way I like to do it is to do the breathing at the same time, so breath work at the same time, because then you're lowering your body's, you're kind of kicking into your parasympathetic nervous system there. You're lowering your body's stress responses. You're putting everything down into calm. You're taking everything out of fight or flight. So if you're struggling with anxiety, which most people are when they're ill in some degree, that just takes everything down so your body can focus on healing. So you literally find the point and then you just press. You can also tap, or you can sort of massage as well. So that's how acupuncture, acupressure, and kind of reflexology, although that's a separate one. We're going to be talking about that another day. So that's how they work. It's all about finding the right spot, finding the right sort of junction, if you will, and removing the blockages, stimulating healing, stimulating energy at the points that are appropriate for your illness, for your condition, for the symptoms that you're experiencing, for the root causes. And this does look at triggers, causes, and symptoms as well. The other one I mentioned is Moxibustious. If you've ever seen Moxibustious advertised and you don't know what it is, Moxibustious again is based on acupuncture. So we use acupuncture points, we use the meridian channels. It's all exactly the same, but Moxibustious uses what looks like, I actually got one, but I forgot to bring it through. perfect. I got one out of my treatment room. It looks like a long cigar, and it's basically Chinese herbs that you burn, and then you just hover over the acupuncture point. And that intense heat, it's almost like a laser heat, that intense heat does the same job as an acupuncture needle. So it stimulates the healing at that point. Quite often you'll see Moxibustious done at the same time as acupuncture. So somebody could be having acupuncture with the heat, so the needles are heated up as well. So you might see that advertised as well. So that's basically what Moxibustious is. It absolutely stinks. Some people like the smell. I personally can't stand it. Whenever I do Moxibustious, I have to make sure that they are the last client I see of the day, and I have to have all the windows and everything open for at least 2 hours afterwards. I really don't like the smell, but it's really, really effective. You can also get little Moxibustious, I can't remember what they're called, but they're almost like the incense cones that I was going to say you used to get. I presume you can still get incense cones. But they kind of sit on the skin as well. You kind of get a little plastic holder that you pop on the skin, and they just sit on the skin and just very, very gently burn, so that you're still getting the heat. It doesn't burn the skin, but you're still getting the intense heat on the acupuncture points as well. So you might get a practitioner who pops a few plastic bits on your skin and then puts the Moxibustious cone within the plastic thing. So that's how Moxibustious works. But that's exactly the same. It's done on the same meridian channels. It's done on the same acupuncture points, but it's just using heat instead of the puncturing of the skin. So I hope that helps. In terms of finding an acupuncturist, if you want the puncturing of the skin, then obviously you'll need an in-person therapist to do that. Always look for certified practitioners, licensed practitioners. Most local authorities require you to have a license if you're practicing acupuncture, in exactly the same way as a tattooist requires a license. That's not the same for massage. That massage and sort of non-invasive treatments have different rules, but acupuncture tends to require a license in the local authority area. So make sure the practitioner that you're finding has a license. Make sure that they have the relevant insurance. Insurance isn't a legal obligation in our profession. It's very much a moral stroke risk adverseness issue with a practitioner, whether they want insurance or not. But my advice would always be to find a practitioner with insurance, and make sure you gel with them. I have had acupuncture treatments over many, many years, and some have been horrendous and some have been great. The one thing I would say, a lot of people, when I'm talking to endometriosis people with endometriosis, a lot of the time they report that they tried acupuncture, and it's kind of one extreme or the other. They've tried acupuncture and it worked, or they tried acupuncture and it was horrific. The one thing I'd say, if you have a lot of inflammation, if you have a lot of pain and bloating, then quite often, if not 99.99999% of the time, the acupuncture points that are the ones that are going to actually do a lot of good stuff for you are going to be very, very tender. So as a good example, and actually this is a reflexology point, but I'll go with it. You have a reflexology point on the fleshy bit of your thumb, which is all about your adrenals. And quite often, if you just press that, you could just feel a little bit of tenderness. So especially if you've got something big, if you've got like a job interview or something like that, where you're a little bit anxious and you've been mulling it over for a few days, that adrenal spot is going to be really, really tender. Your anxiety point as well, which is in the middle there. Again, this is reflexology rather than acupressure, but yeah, if you press, you could just start to feel areas of tenderness, almost like a slight bruise in that area. That's because that point is being stimulated, because you've got an imbalance in the point that in the issue that's correlating to that point, if that makes sense. So quite often it'll be the case if you go for acupuncture and you're in the throes of a flare-up, or you're in the throes of anxiety, or all the other stuff that comes with endo, then quite often the acupuncture point, when she puts the needle in, or he, when they put the needle in, may hurt because it's that tender. I've been to people who, when I've had acupuncture, it's absolutely killed and it's bled a little bit. Now, when you see bleeding, this is not necessarily a sign that the acupuncturist isn't very good. Quite often it's just a sign that you've got a bit of blood kind of stagnating there. So by pricking the skin at that point, it's actually physically sort of removing those blocks. So it's not necessarily a bad thing if you start to bleed. What is a bad thing is if it doesn't stop bleeding. You only want a tiny bit of blood, if any blood at all. I've lost my train of thought. I think I was trying to tell you what makes a good acupuncturist. But don't give up. If you've seen somebody and it hasn't worked, or you've seen somebody and it hurt, don't give up on acupuncture as a good therapy, because it is a really, really effective way of treating symptoms, causes, and triggers if you find the right therapist. In terms of endometriosis, make sure you find an acupuncturist who has experience of endo, ideally. If you can't find anybody who has experience with endo, then you've got two options. You either work with somebody like me who can direct you to do acupressure yourself, and I can train you how to do that, and I do that with you. Or you find somebody who is qualified and experienced in other things. Both of those are equally good. Or you can do a mixture as well. But ideally, if you want to do in-person acupuncture, then you need to find somebody who is qualified and experienced with endometriosis, or like Sally, balancing hormones, fertility, and things like that. Hormones isn't always an issue with people with endometriosis. So if your cycle is regular, if you don't tend to have any of the other symptoms that come with hormonal imbalance, then hormone balancing treatments aren't going to be right for you. But they will be able, those practitioners like Sally will be able to give you general advice in terms of all the other stuff you've got going on. Or, like I say, come to me and I can look at acupressure and reflexology and all the other stuff with you. But I'll talk about reflexology another time. So I hope that gives a little bit of insight into acupuncture. For those of you who haven't tried it, I would certainly recommend it. For those of you who've tried it and maybe not liked it, then maybe give it another go. I'd be really interested to know in the comments, if you have tried it, what your feedback is. And feel free to mention any kind of findings or positive and negative things that you found, because advice always, if you do have a negative, if you could turn it around and put a positive spin on it in terms of, I found this, but if you do this, that might get over it. That's good, because we're all about positivity in here. So any words of wisdom that you can share, they are always very gratefully received. Okay, I will stop waffling. That is acupuncture and endometriosis. If you have any more questions, if you would like to speak to myself, or if you'd like to speak to Sally, then check out contacting us in the group, so in the Endometriosis Clinic group, or drop me an email or a direct message, and I can either have a chat to you myself, or I can put you in touch with Sally, whichever works best for you. Okay, take care, guys. Have a lovely rest of the week. I shall be in touch at some point over the weekend. Take care.